actually should be live now. I apologize. I just put you through that. We just had like an introduction. Hi, my name is Michelle, and I am joined with a very special guest today. Would you like to introduce yourself again?
Yes, I would love to introduce myself. No way, introduce myself. Okay. My name is Ezra. You can also call me Axo or Axos, but Ezra is my name, my legal name, the name that I go by pretty much everywhere. But my YouTube channel is Axolotlsinatrenchcoat, which is what people also know me as, hence Axos. Um, yeah, and I think that's the same as my blog as well, is Axolotlsinatrenchcoat. So yeah.
I mean, I titled this live Axolotls in a Trench Coat. I'm kind of thinking I should have asked you first, but
No, that's totally fine. Axolotls in a trench coat works.
I love it. And also, I forgot to say welcome back to the tank. I'm sorry, I'm using your lines
Thank
way
you.
too much.
Thank you.
I mean, I'm excited because you kind of wanted to talk about the therapeutic approach to DID and CPTSD, which I think is very valuable because, I mean, how long have you been in therapy at this point?
Oh gosh, that's a good question. I have been in therapy in general, on and off since I think about 2000 and I think it was maybe like 2013, where I would have been 18 years old. I think that was kind of the first time I started going to therapy. But in regards to, like I was diagnosed with DID back in 2017, but I hadn't started actually seeing a specialist for that. And we got the comorbid diagnosis, obviously, CPTSD,
Sure.
but I hadn't started seeing a therapist for that until 2019, I think, was when I started seeing a specialist. So I have been in therapy, since back in 2012, 2013 or whatever, but I haven't been in specialist therapy specific for my DID and CPTSD up until 3 years ago, 4 years ago. Yeah, what is math? Yeah.
I mean, so a lot of your experience has been without specific therapy catering towards that. So have you noticed a lot of changes throughout the last 4 years or so?
Oh yeah, definitely. And especially the different like therapy methods and things like that. I find I've had a lot of learning and growth within parts and as a whole individual ever since seeing a specialist. But I think even more so in the past 2 years since I changed therapists. So my current therapist at the moment, she's not a specialist, but she does have what do you call it, experience with like she's a trauma informed therapist, and she has other clients that have numerous like trauma disorders and dissociative disorders kind of thing. So I think the past 2 years has actually been it's been the most, I guess, experience of like introspection and things like that, and learning a lot more about myself and how I interact with other people and interact with the world. Like I think the past 2 years has really been what has changed my viewpoint and allowed me to challenge my triggers and things like that. Yeah.
Sure. I mean, that's a great topic to talk about. Um, I mean, how did you first realize that you might have CPTSD, DID?
Well, so when I was younger, I mean, I always had this meme, and I say younger as in like high school age. So when I was like, I don't know, like 12, 13 kind of thing. It was always such a meme with my friends that I didn't remember my childhood. Like I thought it was normal because many things that I used to think were normal. I used to just be like, oh yeah, no, I don't remember my childhood. And they'd all be telling me about all these things that they did on their, sixth, seventh birthdays and stuff. And I'd be like, bro, I don't know. So that certainly wasn't something that alerted me to having, CPTSD, but it was just one of those weird things that I noticed at the time, but I also thought was normal. But it wasn't until, and I used to have a lot of nightmares as well, and
Sure.
what I would call waking nightmares, which was when I would remember my nightmares when I was awake, which now I know as flashbacks, but that's what I used to call them. And it wasn't until 2000 and 2016. I think it was at the end of 2016 that Split came out. And I think I spoke about it actually on a video that I did on my YouTube channel, like my diagnosis journey one recently. But that movie came out, and there's so many inaccuracies. Like we all know, there are so many inaccuracies about the idea in that, but there are bits, before that therapist goes on until like that whole thing of like expanding the mind and all of this stuff. There are bits that are true to DID in there, 5%. But I watched that movie and something kind of started to click in my brain. And I always feel so weird when I say, oh, Split made me think about the disorder, because it's just like, you're fake.
Oh, no.
But no,
It's
I
sad.
watched that and it really is. But there were, yeah, certain things in that movie that made me think, oh, these things in my brain or these things that I have been doing aren't normal, right? And it was at that point, I think I was still up in Sydney. I hadn't moved back to my hometown, but I was seeing a therapist still at that time, but I had some attempts at the end of that year, and then that led me to going back to my hometown. And then when I was there, I was more open about my waking nightmares and things like that, and started speaking to a psychologist, a counselor, a peer worker, and a psychiatrist as well. And then I was in and out of a psych unit there a couple of times throughout that year, and then that was when I was diagnosed. So yeah, there were little things in between, like when I noticed that I might have CPTSD, or that I might have DID. Yeah.
Wow. I mean, do you remember when you got your diagnosis?
Yeah, I remember it. Like, it wasn't a thing of him sitting down and being like, oh, this is your diagnosis. It was more, so for me, I had a preliminary diagnosis, like when it's I don't know what they call it in other places, but here it's known as like a prelim diagnosis. So when they suspect that it could be this thing, but they want you to speak to another mental health care team and kind of get it assessed and work through it in therapy. So I received a prelim diagnosis from a psychiatrist that works at like a trauma and dissociation clinic here in Australia, but that was via a telehealth consultation, because my hometown's like a country-ish, like small town kind of thing. So we don't have like a lot of psychiatrists, let alone ones that are specialized or professional enough, to diagnose with complex trauma disorder.
Wow.
But he gave me a prelim diagnosis, and this is after, like, I don't know whether I did like a couple of those, the SCI, I don't know, those test things. I do remember though, I think I did maybe one or two of those with the counselor that I was seeing at the time. I say counselor, she was a qualified psychologist, but she was working under the title of counselor. But I'd done some of those with her, and then he was also provided all of my medical history. And I spoke to him as well, talking about what my experience was like and how I kind of was perceiving the symptoms that I was having. And he was like, yeah, this could be DID. But he then sent me a referral to a local psychologist that had experience with people that have PTSD, trauma dissociation, stuff like that, right? And I was seeing her for a little bit, but I didn't have super regular visits with her. One, because she's a specialist and it's expensive, but also because I started seeing her right around the time I was going in and out of the psych unit in my hometown. So I was mostly speaking to my counselor and my psychologist, but not this specialist psychologist as much. But I was speaking to her. And then when I was in and out of the psych unit, which ranged from like a couple of days, I think was my shortest visit, up to maybe 3 or 4 weeks was the longest visit I had. So I was quite not well known, but I did have a lot of conversations with psychiatrists and the nursing team there and everything like that. And it was after that I think it was later in that year of 2017 that I was diagnosed officially, I suppose. Like, it was written up as like, yeah, this is a confirmed diagnosis.
Wow.
And yeah, that's how that all happened. Mm.
I mean, first of all, thank you everyone. Thank you for sharing, and thank you everyone who
Also, hi
is
everyone.
here. If anybody has any questions, I'm sure we would be happy to, we, as if I'm answering them, would be happy to answer it. I do have a question from Eva, and her question is, what has been the hardest hurdle to overcome since being in therapy for DID CPTSD?
Oh gosh.
It's kind of a hard question.
I think, yeah, that's a very good question. I feel like there's certainly been a lot of difficult things. The first thing that comes to my mind, I suppose, is most recently, something that I personally, as a part, Mila, but literally just call me Ezra, but like
Sure.
that I personally have struggled with as a part that holds trauma, where other parts, don't, kind of thing. But I have found it really difficult to be open. Like, I find it really difficult to be open and to be vulnerable to people,
God.
because typically my job, my role, or however you want to call it, kind of thing, as a protective mechanism, is to keep my walls up and not show emotion, because in my mind emotion is a sign of weakness, kind of thing. And I have struggled, like, it's only been in the past couple of weeks that I feel like I've made a breakthrough in being comfortable expressing my emotions or my thoughts about my emotions to even to my therapist that I've been seeing for years, and that, as a whole, like, I'm very comfortable with. But I think that would be the most difficult thing for me, and being able to admit to things that trigger me. So typically I would not I would not admit to that, because again, it would be in my mind, it's that internalized perception of, oh, this is weakness. To be able to show this vulnerability, it's weakness. So having to challenge myself, and this isn't just a thing that, is in therapy, because I feel with therapy in general, it's like you can't necessarily expect growth and change to happen simply by, oh, I'm going to go to therapy, I'm going to do these exercises in therapy. Like, you need to be doing them outside of that environment as well to be able to see actual progression, growth and healing, kind of thing. So me practicing both in therapy and at home, just sitting with my emotions and recognizing my triggers and being able to point them out is it has been so difficult. And to some people it might seem like a very simple thing, right? But I think that is the largest hurdle I personally, as a part, have had. I think in general, as myself, the whole being that is Ezra, one of the hardest things though would also be allowing, not like allowing, but having different communication with parts, and not to make everything like alters, right? Because I don't like that in the community. But having communication and allowing contradicting thoughts to just kind of sit and exist, like, rather than push them away, to just be able to kind of sit in it, even though it is extremely uncomfortable at times, because a lot of the perceptions of certain parts or certain alters or anything like that, it is based off of what you have kind of learned from an abuser or things like that, right? So it's very uncomfortable to have to sit with those thoughts, and something like, for example, like, oh, you're a bad person, like, just as a simple example, kind of thing, like, you're a bad person, to be able to sit with that rather than to push it away, because I used to think the method was just best to, like, just push it away, just combat that thought. Whereas what my therapist at the moment has taught me, and what I personally, because therapy is different for everyone, right, but I've definitely found it helps me to just be able to sit with it. And as much as I hate it, it has really helped improve that trust and communication between certain parts. And then from that, obviously, different parts are more willing to speak to my therapist and kind of come together in that healing process as a whole.
I mean, it's so funny you say that, because, like, I've kind of just had that conversation with my therapist about how, like, it's okay to be uncomfortable. You always want to put out the fire in your head, distraction, all that stuff.
Yeah, 100%.
Fellow Australian.
Hey, fellow Australian.
Have you experienced psychiatrists and other mental health professionals who don't believe in DID?
Yeah, I have. One of the psychiatrists actually at the hospital that I was at, like inpatient. So because it was in my hometown and my hometown is small,
Sure.
it's we had fly in, fly out psychiatrists, right? So even though they were the same, they were on a rotation kind of thing. So there were two there during the main like during the I think first like 7 months of the year there were two, and then there was another one, but not one of the first ones. Anyway, so they were fly in, fly out. So they would fly in from Sydney to my hometown, and one of them did not yeah, he didn't
No,
believe
please.
in DID. He would be like, I would be trying to talk about things to him, and he'd be like, oh, we've all got different personas that we put on. We've got, the
Yeah,
persona that we put on at work. We've got the persona we put on in front of our friends.
true.
And I'm like, bro, yes, well, that is true. That is not what this
Yeah, I'm
is.
sorry.
Like, that's
I
not what
laugh,
I'm
but
experiencing. Oh,
it's
no,
disgusting and
it's fine to
tragic.
laugh. I laugh too.
I mean, it is tragic how professionals can look at something in the DSM-5 and just why I'm confused. I can't even imagine how
They
devastating
treat
it
it
is.
Yeah, they treat it like it's just like some sort of post-it note, like as in like the DID is just a post-it note put in the DSM and not like actually in there. And the same goes for, I mean, I've never actually looked at the ICD, but it's in the ICD as well, isn't it? Is that the UK one? I don't know that thing, ICD-10 or something,
Yeah.
acronyms.
Um,
But yeah, no, I've had that experience with psychiatrists. There was also funny story actually. I wrote it, I think I shared it on my Twitter actually yesterday. Ezra Adalia, follow me.
link in the
But
description.
I know, right? But my partner who also has I think it's OSDD. Yeah, I think it's either DID or OSDD. I don't know. But she, when she had been looking for a therapist at one point, like not long after we'd first like got together, she was changing her therapist, and there was this lady that she spoke to, and I suppose this isn't really a psychiatrist, but it's a psychologist, right? So she was speaking to her, saying, "Oh, do you know what OSDD is?" And the lady said, "No." And my partner Mary, she was just like, oh, well, it's kind of like DID. And then she was like explaining the little subsets for it and stuff like that. And the lady was like, oh, I don't keep up to date with the DSM. Like it's some sort of, I don't know, magazine subscription.
What? I feel
It's
like,
like I don't keep up to date with it. And it had been out for like seven, like as in the DSM-5 had been out for 7 years at that point, right?
oh my God.
I don't keep up to date with it.
I always just assumed that like the psychologists knew about this stuff, but they were dismissive of it. I never thought that they just wouldn't bother. But
Yeah, yeah.
absolutely. I mean, okay. Are there any specific therapeutic approaches? I mean, I know there's like EMDR, DBT, CBT. Is there anything that you found specifically helpful?
Oh, that is a very good question. Hold on, let me. Come on, brain. What?
Um, who is Zeta Math? Because someone's saying that you look strikingly similar. Zeta Math
Do
does
you?
puzzles. I'll look it up.
I don't even know how to spell
I
that. Now
hope that's
I'm
a
very
compliment.
confused.
I'm sure it is.
I hope so. Right, therapy. That's right. You were asking about the therapy
Sorry,
technique.
sidetracked.
I was like just getting up on my other screen, like my therapist's website, so I actually know the names of the things.
Oh, fantastic.
So yeah, so one of the things that I personally enjoy is somatic therapy. So I mean, from reading this, it's like a combination of like talk therapy and like physical like perceptual like attunement, things like that to the body. So how experiences in life, traumatic or otherwise, like experience affect the body and the nervous system and things like that. So being able to identify whereabouts in my body I am feeling, anger or anxiety. Like, am I feeling it in my chest? Am I feeling like a tingliness or like a jitteriness kind of thing in my arms, things like that. Like, I find that is really helpful, especially in grounding myself in my body kind of thing. Like, rather than being all up in the air and dissociating, being able to recognize where I'm feeling certain things is certainly very grounding, because it just pulls me into my own experience and existing in the moment kind of thing. That's probably like my favorite therapy kind. I haven't started EMDR yet. Like, it's a gradual process that I've been preparing for, because you can't, well, I mean, you could, but you shouldn't just jump into EMDR, right, with a therapist. So I've been preparing for that, and part of that is working on not necessarily like assigning, but having different parts or alters kind of thing that can step to the front if things get too, triggering or emotional kind of thing, like having a certain part or a couple of them to that the therapist can bring forward kind of thing. So like voluntary switching, so to speak. I guess that would be a way of describing it. But specific to doing it during the EMDR process if necessary, to so that I don't completely freak out when I'm leaving my session.
I mean, let me see. I can't even imagine having to go through, like, I find a lot of therapy for trauma is, in the end, like being able to relive those memories, I don't know, without having a flashback, and it just sounds like the most painful. It's groundbreaking, and I don't know. I guess, well, first of all, what's most important is, like, how do you build a relationship that you can trust your therapist?
Oh gosh, that's a good question. I think also to anyone watching, the reason why I do go I put mute on it sometimes is because I have a dog and she barks very loudly, and
very important.
Loud noises are not good bark. But how do I find trust therapists? That's a good question, actually. I think that, I mean, certainly time plays a big role in that. And it's difficult as well when you have gone through a couple of therapists, or you have to, go through a couple of therapists in order to find who fits you. It can just feel like you're just having to open up over and over again, even if it isn't, you don't just walk in first session. I mean, sometimes you do, because, it's a trauma response, to kind of, not like trauma dump, but you know what I mean, right? Like, having to go through therapists means you have to, like, open up that trust to be able to do that. You have to tell them your backstory, even if it's just like, this is my name, age, I live here, this is where I grew up, this is, where I'm currently living, or my living situation at the moment. Like, doing that over and over again is quite tiresome while you're looking for someone that actually fits. I think, though, what was really useful, their job is to help me, and if I can give them not necessarily the tools, but the tools to understand me as a person kind of thing. If I can say, hey, these are things that I already have learned about, or these are things that I want to work on, or these are things that I even want to know, to be educated more about. Because sometimes in my therapy sessions, I go there and I'll ask my therapist questions. Like, I won't even be talking about myself. I'll just want to know about the brain and things, like things about, like, the vagus nerve, like all of these kind of things, right? It's like, write down, like, I've written down, like, questions that I have for my therapist, or asking, how much do you know about, like, autism, or how that presents in people, because I'm also someone that's autistic, and I want a therapist that's also going to be able to understand the different the different intersections that I have of different whether it be race, disability, gender, things like that. Just being able to note all of those things down is something that really helped me immensely when changing over to my current therapist and finding her to be the right fit for me.
Absolutely. I mean, do you find any sort of like discrimination or difficult times being a POC with mental illness?
Not so much in my experience in Australia. Obviously, that doesn't speak for everyone in Australia, but I know it's certainly like when I think about, racism here compared to things like the United States, like it's definitely still prevalent in Australia, but
Absolutely.
not to the same extent. I think as well, it certainly has been a lot easier for me to find a therapist because of location. Like Sydney is it's a city. Like it's not the capital city of Australia like many people think. It is the capital of New South Wales though. But there's certainly a lot more access to therapists, and the demographic here is very culturally like diverse in Sydney. So I personally haven't found a problem with finding therapists, and that's not even from a like doing therapy like privately or anything like that, because all the previous therapists that I have seen have been through the public system. But that being said as well, obviously things like finances can make it a lot easier to find someone that is very like specific to certain needs that you may have. Fortunately, though, I'm privileged enough to be disabled enough to be on NDI.
Wow.
I say that ever so sarcastically because I don't, in terms of things that I count as a privilege, I think it's a like, yeah, it's like a double-edged sword, really. It's like, am I privileged by being disabled, so therefore I've qualified to get therapy sessions paid for? I'm like, I don't know whether that counts as privilege, but I'm fortunate enough.
Not really.
Yeah, exactly. Yeah, but certainly for me being on NDIS, which is the National Disability Insurance Scheme in Australia, it means that I'm able to have more frequent therapy sessions than I would have been able to have prior to that, which when I was having them before, it's like in Australia, there's Medicare and you get 10 free visits a year, which is great because a lot of places don't have that. But also, if you have a complex trauma disorder, 10 visits in a year isn't actually that much.
Oh my God, I was going to say, like, that's a lot. Like, 10 a year is nothing. But
no.
I'm going to let my cat in really quick.
Oh yeah, no, please. Feel free. Also, is that a squishmallow on your chair, or am I just like super blind? I love that I'm wearing my glasses and I still can't even see.
No, you're fine. She insists on ruining this. No. Say hi.
Oh, she's so cute.
I'm sorry. Oh my gosh, don't you have a cat who looks like this?
I do. I don't know where he is though.
Who looks like this?
I've got like, that's even like the stray cat that's like roams around our street is also black and white as well. But we've got three cats, a German Shepherd, and 2 rabbits. We've got a lot of animals.
Well, we were wondering, how do you manage, or what coping mechanisms have you developed to manage dissociation?
Trying to think of specific ones, really. I mean, something that I personally find doesn't help me and that I really don't like is the whole, like, the five things, like that census one. Like, I don't like that. I'm not a fan of that. But that's just me, though.
I appreciate that.
Certainly, like, the thing of the somatic therapy and managing my dissociation along with triggers is definitely that thing of being more aware of my body or being more aware of my surroundings, being able to identify whereabouts in my body I'm feeling certain things, being able to be curious, really, not needing to always have the answers as to why I may be dissociating, which is a challenge because I like to understand, like, as I say to my therapist, like, I like to understand things in order to understand things, but being able to just not always need to know the answer as to why I'm dissociating, and just kind of work on, like, there are times when I just sit in the dissociation. Like I just need to sit there for a little bit before I think, okay, these are these tools that I kind of have. Like, where am I feeling this in my body? Or can I sense any kind of like, can I identify any kind of like emotional communication kind of thing coming through? And then think back over, oh, what was this thing? Like, if I'm not, like naturally you'll find an answer to things versus when you kind of force yourself to find an answer to things, right?
Yeah.
So I'll ask that question to myself of, oh, do I know what it was that I was doing or I was saying before this to feel this way? And then sometimes being able to address that, and primarily, in therapy is when I would address it rather than if I'm at home and I think, oh, what are these things that made me feel this way? And, a memory of like things like CSA or anything like that comes up, right? Like I wouldn't like address that head on at home. I'd be like, oh, okay, I've acknowledged that that's the thing that is probably affecting me as a trigger, but then I'll bring myself back to what are the things that I typically use for grounding? Like, is it something, usually for me, like something that I find helpful is petting my bunny rabbits, just because they are very, very soft. So being able to pet them and have that sensation on my hand kind of brings me back down to earth, brings me back down to my body, things like that, or listening to certain music for me, or even sometimes, and this isn't necessarily a thing that I've learned in therapy, but just for me, being able to channel my, and I'm not an educated, this isn't advice, this is just my experience, but being able to channel my emotion from something into something else. Like if I'm feeling a heavy kind of emotion like sadness or frustration, sometimes I will put on a song that reminds me of my nan, who was a very big positive role model for me in my life, but she passed away like years ago because old people, right? Me laughing with serious topics, but like I'll put a song on like that, right? And that will kind of ease the trigger of whatever it was that had upset me initially and move that emotion through to something that, obviously it's sad that she did pass away, but it brings me around to positive memories kind of thing. And being able to listen to that song and kind of cry to that, it makes it easier for me personally to ground myself back up from that memory rather than something else. So that's something that I do sometimes. Otherwise, in the past, like I've definitely been prone to like kind of just like being like engulfed kind of thing in the dissociation, because it is that scientific thing, right, of your what is it, like your prefrontal cortex kind of not like kind of like shutting down essentially. Like it's like there's that when you get out of your emotional threshold, like when you go over your emotional threshold in your window of tolerance, like sometimes you're literally like incapable of being able to take those tools and things that you've learned from therapy and put them into place, because that logic part of the brain is not there. It's just you're being driven by that emotional. Yeah. So sometimes there has definitely been, in the past cases where I haven't been able to really do much about my dissociation, but taking a nap sometimes did help.
I mean, amazing, anything. It's just, is dissociation what is that sensation for you? Is it uncomfortable?
It varies. I definitely don't, like, it's not something that I enjoy feeling.
Oh my God.
For the most part. Don't think many people do. But it definitely varies. Like, and I think it varies probably depending on a lot of things, like whether it be triggers, like even for me, and I don't know whether this is specific to trauma or whether it has to do with an overlap of, other disorders or anything like that I have. But sometimes for me, weather can be a trigger. Like weather will trigger me to dissociate, but in different ways. Like I explained to my therapist that when things are like dreary kind of weather, it feels like how did I describe it? It feels like you're kind of in a nightmare or in a very ghost town kind of like dream state, right? Everything just feels like slow and very heavy and sluggish, and it just feels very like a very ominous kind of feeling. Whereas if the weather is quite bright outside and I'm dissociating anyway, like everything, because it is, bright, it just feels like a dreamscape, but everything just doesn't feel real at all. It's like that big derealization, depersonalization, all of that stuff, right? But it certainly varies. Like the dissociation I have can feel like those things, or it can just feel like a spacey kind of out of body, not feeling as though not feeling as though my body is mine, or feeling as though my therapist, or when I'm not in therapy, like feeling as though things are just so far away, like, and nothing feels like, I think there's an actual word for it, but the side, like that distortion kind of thing, like things don't feel as big as they are, or as small as they are, or near or far, or things like that. So the dissociation, it definitely does vary depending on the situation or the triggers kind of thing for me.
I mean, would you say that during dissociation you kind of feel unsafe?
Yes, and well, I certainly wouldn't say that I feel safe. But yeah, that being said, I don't know. I think a lot of the time when I'm dissociated to a larger extent, I suppose, I don't think I personally feel unsafe, because I personally don't feel anything. But there are times when it's like, I'm still within my kind of window, and I recognize that I'm dissociating, and there certainly is that feeling of vulnerability. Yeah.
I appreciate that. I mean, I was kind of thinking we could dive into the therapeutic process of managing different identities and understanding why they're there. I don't know if identity is the right word, but...
People use a lot of different words. I personally use the word parts just because it's, I don't know. I used to use the word alters a lot, and there's nothing wrong with using the word alters. I feel like just for me, like after being in the community for so long, and some of the interactions with people that I've had, I've just like, the word just like, it just gives me the ick to use myself, but that's just me. Like that's nothing singlet. Actually against it. That's just personal. Exactly, it's just personal preference, I suppose. But I do use the term parts.
I appreciate it. You
question. What's the question?
Well,
thank you. Oh yeah, the parts. What was the question?
I was wondering if in therapy you go over managing different parts and why they're there.
Right. Yeah. So for me, I think a lot of the work that I did starting on that kind of process was when I was first with my specialist. I'm just trying to think how we did that. I think initially she had me write down a list kind of thing of the parts that I was aware of, and what, not necessarily what each part is like, but kind of, and not even like what triggers like each part has, but just a general overview of, oh, these are the situations that this part might be most helpful with, for example, like, oh, this is the part that is typically around for things like, for things like work, or things that are typically like very, very professional or social like things. Like, this is the part that is usually around for this, or this is the part that is usually, for specific situations, like, oh, a certain part is triggered for some reason and does like phone call related things, being able to note that down. And she was very encouraging, I suppose, which was also a thing that annoyed me, but she was very encouraging of making sure that whenever I came into therapy, that everyone was kind of present, which was very difficult to kind of ensure, because you can't be like, okay, everyone, let's come to therapy.
I can't even imagine.
I'm like, sure, let's just gather everyone up.
Right, easy.
Seems easy to do. But yeah, allowing, me not trying to trash talk my previous therapist. With my current therapist, she invites everyone to kind of be present if they want. So it's kind of like we'll sit down at the beginning of the session. I think it's even in some of my like audio things that I share online, but of just sitting down and being like, let's welcome the yawns, because typically I yawn when I'm dissociating, but welcome the yawns, welcome anyone who is present and wants to be present, anyone that wants to share anything, know that this is a safe space for them. And she says that to me every session that I go to, which is really, it's just very like welcoming and encouraging. But being able to have that initially to kind of build that trust and that safety net, but also something that we do work on, or more recently we've been working on, is like having a therapist that is okay and doesn't push parts of self that may not like them. Like there's always going to be those protective parts that obviously they're not going to want to be challenged by the therapist, and they're not going to want to change their ideas and their perception that they have because of how ingrained things are from abusers in the past, kind of thing. And having a therapist that isn't combating that straight away, like isn't like, oh well, these thoughts are because due to like things like grooming or whatever, stuff like that, right? Like having a therapist that is just okay to just sit there and be like, yeah, I get it, you don't like me, kind of thing. Dog.
I can appreciate that. That's very important. Sorry about your doggy.
It's okay. Having her just do that has allowed more parts to feel as though it is a safe space and feel comfortable to share things with her, and to feel as though like they're not being, like that their perceptions aren't, like that the goal of therapy isn't to change their perceptions, like it's to allow that collaborative, integrative approach of different parts working together. And even though I might not agree with this certain part and they don't agree with me, just being able to have us in the same metaphorical, or if you have like an inner world room kind of thing, but have them in that same space existing together, even though they don't like what each other has to say, but not necessarily having to change those opinions or challenge those viewpoints straight away. I think that's been the biggest thing that has been helpful. I don't know whether that necessarily answered the question at all. Working with parts and things that did that answer the question? I don't know. I guess we're on tangents a lot of the time.
I mean, I can't even imagine having me in a room full of like people I potentially disagree with, and just having to be like, it's okay that we disagree. So commendable.
Yeah.
Eva wants to know, do you find having a routine day-to-day and planning ahead for outings helps with triggers and flashbacks?
Probably. I don't know. I'm a very I don't know whether I'm necessarily introverted. I think a lot of it just like has to do with like being autistic and not doing well in like crowds of people.
Okay.
So I literally don't leave the house much at all. The only times I will go out of the house, at least at the moment, is typically for my therapy, which is once a week, or I'll go out with my partner for coffee, but that's only if things are planned, because I don't do well with like spontaneity. But I don't know. I think having a routine has been something that has been helpful in the past. Like it's definitely helpful for me on days that I do have therapy, like on days that I do leave the house. I think for me it's a lot of different like disorders and things interact with that ability as well, to have and to keep a routine. But I was actually speaking, funnily enough, like with because I've got a care worker. I was speaking with her yesterday because she was taking me to therapy, and we were talking about how it's useful for her, because she has a child that has a trauma disorder, but it's useful for her child to have a list So of things to do, which I suppose is kind of like a routine, right? Of things to do for a day. And it doesn't have to be an extensive list of things, but just of things to do so that at the end of the day, she doesn't feel as though she hasn't, like, even though she still judges herself and says, oh, I'm not doing this enough, or I'm not, I haven't done enough. Like, being able to look at the list and say, well, I have done these things on my list, so therefore I have done enough. Like, and like I said, like it's not designed to be this extensive list of like all these possibilities. It's like I don't want to say the bare minimum because that has like negative connotations, right? But like just simple, small, like day-to-day existing tasks kind of thing.
Absolutely.
Because for those who do have, different disabilities, disorders, neurodivergencies, right? Like those are difficult things. It's that trying to set yourself those goals and not compare yourself, which is so much easier said than done, right? But to other people that don't have the same condition or that aren't in the same situation as you. So being able to just set those core goals, I feel like that would be, certainly something that would be helpful. And I can see I can see why a routine would also be a very useful thing to have. Yeah.
I mean, does it make you feel sad at all when you see like people online who have this perfect communication with their system and like?
Yeah, like there's definitely a sense of like, I don't know whether it's so much nowadays as a sense of envy. I think definitely a couple of years ago it would have been like an envy or jealousy. For me at the moment, like I do have pretty decent communication with, I'd say like 60 or 70%, but it's not crystal clear of me just being like, oh, so and so, like, are you around and just having a conversation with them? Like my understanding personally of what I would define as crystal clear communication would be if I am triggered by something and having Scribe, who is a very like maternal, very logical, like that, very like, prefrontal cortex, whatever kind of thing part, right? Like being able to have them around and being able to have any kind of communication during those triggering times, that to me is pretty crystal clear, like communication. That is like, great, in these times of need, I'm able to have a lot of those resources of grounding and things like that. But it does confuse me a lot when, people do have complete, like, just, and I know every system is different, but also that phrase, like, absolutely, like, it annoys me. But, like, I know every system is obviously different, but it just does baffle me that there are people that have complete, conversations just back and forth. Because I'm like, well, isn't, like, it just seems very opposite of dissociation to me. And especially if it's people who haven't been doing, like, whether it be due to access or anything like that, people that haven't been in regular therapy or therapy for a long time kind of thing. It just doesn't make sense in my brain that they are able to resource all of these things, but also where did you find these resources to be able to have that communication, especially during times that are triggering?
Yeah. I mean, you kind of alluded to like feeling very grateful that you have this communication. No, please. I don't know if you can hear me or not, but I'll ask again. Because I'm thinking like, that means that you before had not had communication. And as a person I know that they might not be able to hear me, but with a person without DID, it is scary to imagine. It's scary to imagine like before the therapeutic process not being able to have that communication.
Yeah, no, I did hear all of that as well. I've got my earbuds in. Like when I think back to before I started seeing a therapist, and before I was even like diagnosed, it's just so wild to me how much has changed like over the past. I'm bad at math. What is 7? What is math? I'm
27?
just counting on my fingers. I'm like 18,
I
19,
still use
20,
my
21,
fingers
22,
too.
23. So over the past 6 years, like since diagnosis, and then if I look at, what my life was like pre-diagnosis, it's just so wild to think about the times where I didn't have like any communication, like parts were just not aware of each other. Um, yeah, it's just really weird to think back on, kind of thing. It's like, oh, or weird to even think back on how normal I thought things were, like how
Um,
normal I thought it was to not remember things, like how normal I thought it was to not remember huge parts of my
oh
childhood,
my
to not
God.
remember parts of my week, to not remember parts of my day. Like I just thought it was so normal. And so it's really, yeah, the word that I struggle with the most in therapy and feeling is I'm proud of myself.
That
I
is so
cringe at that word because
good.
I'm like, I hate it.
I know it's ridiculous. It's like, why is it so hard to say?
Yeah, but I'm proud of myself for all of that
Yeah.
progress that I have made,
Oh my
because yeah,
God.
there didn't used to be communication. There was only communication really between, I think, two parts. Um, but not necessarily the host at the time, I suppose. Whereas now a lot of, there's definitely like that communication between the, what's the word, like a lot of the ANPs or whatever, right? And then certain parts that hold trauma, like, for myself, for example, like being comfortable to share that trauma with other parts and feeling as though it's not something that I individually just need to hold. But yeah, a big part of that is definitely trust. Um, and it's yeah, it's weird to think back on that wasn't a thing that was there before and now it is.
I mean, it's so odd that like I was saying to you like what is it like thinking the way that I do now as a person without DID, having better communication, and you're like and then there's AJ in the comments saying like I just thought that gaps in memory, all of this stuff was normal. I had no idea. It's
Yeah, yeah, it's that thing, right? It's like if it's what you're used to, of course you think it's normal.
yeah.
And it's just like, and then it gets pointed out to you that like, oh, that's not the typical experience, because obviously, there are some people out there that don't have trauma, they just don't remember their childhood, but also, it's one of those things where it's like not necessarily like a prerequisite, because amnesia, when it comes to the DSM, for DID, I think there are like a couple of different subsets that it can fall into.
Mm-hmm.
But brain, you just went completely off track. What was I saying? Yeah, it's wild that yeah, there are things that you experience day-to-day life and you think is normal, and then it gets pointed out and you're like, oh, not everyone experiences that. Oh, that makes sense as to why I am struggling with, XYZ. Yeah, it's just it's wild.
I mean, there's no control effort. It's not like you know what it's like to not have DID. So, um,
Exactly.
I mean, what is your opinion on those who do non-educational videos? Because you seem well educated, which is something that is sometimes lacking on sites and communities.
Well, I mean, thank you, thank you.
I know, it's so nice.
I me educated. I think,
Me?
yeah,
Education?
I certainly, I don't necessarily think I'm super educated on topics, but that being said, I think something I have.
It's the dog, y'all. You were asking, what is your opinion on non-educational videos? I mean, yeah, that's why I wanted Oxos on here, is because they were like, dude, I'm here to talk about the therapeutic process. Okay, continue.
You can feel free to, like, feel free to talk. I'm not gonna like,
Oh yeah,
hijack
well,
everything and
like
be like me, me, me.
I don't know what to talk about when you go away, so I just start talking.
Oh, Educational. Oh, yeah, right. I wouldn't count myself as super educational. Like I don't obviously, I don't have a degree or anything, but I think something that I've definitely learned online over the years is that speaking from like I call myself an advocate, but I also like to preface that with I'm a lived experience advocate. I'm not an advocate that has a background or that's, well read in all things, trauma and dissociation. I mean, I'm learning about those things over time, but also because of trauma and dissociation, it's sitting down and reading a book it's a process. But I think I do wish that if people are going to make educational videos, that depending on the topic, they I think just prefacing it with, oh, I'm not, educational, like I'm not an educational source. Like sometimes it's just not enough. Again, depending on the topic. Other times I think, that's a great thing to say at the beginning of videos, right? Like, oh, I'm not an educator. I'm just speaking from experience. But excuse me. Yeah, I think how do I put that in a sentence? My brain is like, I
mean,
I think that I wish that people, if they're trying to make videos that are from an educational perspective, that they would put in things like sources. And I know, again, that that's hard because that requires time and reading, and that's difficult with dissociation and trauma disorders. But I feel like if you are making the effort to educate people, that is a good way to start, is by educating yourself, because you can't really educate anyone without being educated yourself. So yeah, to be able to cite sources and to be able to, just also speak about things as well from I don't think generalized perspective is the word that I'm after, but you see a lot in online communities that people speak to a very, I wouldn't say a niche experience, but when you think of like the online DID community, right? Like it's very heavily portrayed that overt. There we go. I'm like open, close, open, yes. Overt, covert. Yeah. That overt, like DID spaces online, overt presentation seems to be the majority. When you look at, research for the disorder, is that overt presentation isn't nearly as common. Like it's the minority percentage, right? And that's not to say that people that do have overt DID shouldn't be posting online or anything like that, because everyone should be able to, you should be able to share your experience, right? But I think that it is important for people that fall in those outliers to be able to say, to kind of just be able to hone in on the fact that this is my experience, but my experience isn't the typical experience of the majority with this disorder. Like I feel like there is some level of responsibility, and maybe that's just like my personal opinion, kind of thing. And I think obviously that also depends on, how many people are viewing, like how large their audience might be. But yeah, I think being able to educate yourself on things, certain topics probably shouldn't be spoken about unless you are a professional. And yeah, being able to identify that you are an outlier, and that's just your experience as someone, with the disorder. I don't know whether that made sense.
No, it absolutely does. I mean, like we have AJ here saying that genuine DID lived experiences are the experts, which I agree with. As much as you study about DID, you can't understand what it's like to have it if you don't have it. However, then we have Neil Peggy, who's saying that there are people who then come out and say that they faked it, and so it's like, how are you even? I don't know. That was just my input. But then does the interviewer have DID too? Eva, why did you say yes? Thank you, though.
I think that was a good point though that you did. I'm scrolling through the chat because I don't remember who exactly said it, but about yeah, people that have it are certainly people that have the disorder are certainly more educated. No, that's a very generalized thing. If I were to say that as a sentence, people who have the disorder are certainly more educated on the disorder than those who don't have the disorder and don't have any educational background around it.
Okay.
There we go. That's the right sentence that I'm after. But that being said as well, obviously everyone, everyone's experience with the disorder is going to be different to a degree, like, still within the DSM realms and stipulations of what makes the disorder right. But everyone's experience is going to be different. But at the same time, obviously, just having the disorder doesn't necessarily make you an authority on the subject, because some symptoms and things, or some things that you scratching on that, sorry, cat.
Angel.
Yeah, some symptoms and things that you experience that you may portray as, oh, this is DID. They could just be things that they could just be quirks and stuff that you do as a person, or if you have different disorders that go along with DID, or other like disabilities or things like that, or if what you're doing is not necessarily like a mirroring, or it's something like, whether it be like cultural, or it's something that you're doing because it's a common quirk that, or behavior that you do within your family or your friend group kind of thing. So yeah, I think having DID, yeah, it makes you more educated on the subject than someone who doesn't have DID, and that also at the same time doesn't have an educational background on DID and trauma disorders. But at the same time, I don't believe it makes you an authority on the subject as a whole. Yeah. I hope that made sense.
I mean, absolutely, because it's like, I would not speak on my generalized anxiety disorder. I don't know what's my personality and what is actually, you know what I mean? Wait.
Your video cut off.
Wait.
Oh, you leave me.
I'm here.
I can still hear you. I just can't see you. Right.
What? Hi.
Trying to
sorry.
wrangle a cat. Oh no.
Well, I mean, a lot of people. Hello.
That was the black and white cat, but he's gone into the background now.
I saw him for a second. It made me happy. But I mean, a lot of people with PTSD, CPTSD, trauma-based disorders have sleep issues. Do you deal with like switching and dissociation when you're trying to sleep? Or just insomnia?
I don't. I definitely deal with insomnia. When it comes to sleeping, like, there certainly were times in the past where, like, when I think of, post-diagnosis kind of thing, that certain alters, and obviously this also makes it like pre-diagnosis, but like that certain alters would be the ones to go to sleep, or that would be triggered out by the concept that is sleeping kind of thing, due to that being like associated with certain traumas in my past kind of thing. So that can make it difficult, because even I, as a part Mila kind of thing, like I find it not so much as a difficulty to get to sleep, but I will avoid sleep. Like there will be times, like especially if I'm feeling triggered in general, or at certain times of the year, I just won't want to sleep. Like I will do everything to avoid sleep. And obviously that does lead to problems the next day, because I'll be like super tired and things like that. But then there are times when I will go to sleep and I'll have like nightmares and things like that, and I'll wake up in the middle of the night, or multiple times in the middle of the night, and it's a struggle. I definitely think though, working on things in therapy, I suppose it is kind of like a double-edged sword though, because sometimes you'll be working on something in therapy and it'll bring up memories and stuff like that, which in turn your brain will be trying to process over sleep, because whatever the sleep science is, however that works in brains and stuff, right? So it can make getting any sleep difficult for a period of time. Like, I think even yesterday it was when I had therapy, I was speaking with my therapist about how I have had a larger amount of insomnia lately. And I think a lot of that, though, is due to, I don't think it counts as like processing certain memories, but certain memories coming up. Because at the moment, like, aside from this, like at the moment, I'm writing, and I want to have as a goal to publish it, but I am currently writing a memoir. So doing that is bringing up a lot of, memories and stuff from childhood. And in turn, my brain is just like, oh, what the hell's going on here? And trying to sort those out when I'm sleeping. But there have been times though where certain alters are like younger parts, for example, that will come out with simply the role to sleep. Like, there's one certain part that, yeah, she if I'm like super tired, like really, really, really tired, like she will come out and just do her little like shadow puppets kind of thing, and then just go to sleep. She'll just zonk out, and like I'll be zonked out for the entire night, kind of thing. Yeah, so certain alters, certain parts for me definitely do have more or less insomnia.
Okay, I mean, that just shows you how different each part is, basically. I mean, I'm sure there's even different reasons. I mean, anyways. I mean, there's a question that AJ wanted to know. Did anyone ever tell you, or did you ever think that your disorder was demon possession?
No, not for me, no. I think there was definitely like people not understanding it. Like when I told my friends about it back in my hometown, like in 2017, they didn't like understand it, but I don't think I've had any experience interacting with people that thought it was anything to do with demon possession. But that's also because I don't really talk to people, so.
I mean, that's amazing, because it's just, you just genuinely thought that this is how everybody lives. Let me see. Have you encountered any misconceptions or stigmas about DID?
I'm waiting for my dog to stop barking. Have I experienced any? Wait, what was the question? Something about misconceptions? DID?
Yeah, any misconceptions or stigmas about DID?
Offline or online or both?
Sorry?
Sorry, offline or online or both? Like, as in just in general?
Both, because like, I mean, I can definitely see how online can be an issue, but in real life it is almost more impactful. I don't know.
Yeah, I think definitely when it comes to like just let's break this down per area. So offline, right? I think there has been experiences where I have experienced that misconception. I mean, for those of you who have who were already watching earlier when I was talking about my experience with psychiatrists, right? There was that psychiatrist that I spoke to that he was like, oh, we all have different personas that we put on depending on where we go. So that's certainly something that I have experienced there. I think as well, I think this kind of overlaps with both topics, but I think there has been like maybe one or two interactions that I have had with previous psychologists that, and this was right before I started seeing my specialist like 4 years ago or whatever, but they have, I'm so sorry.
Oh no, you're totally fine. So basically they have a doggy and he's in the videos. Or she, I don't even know. What is the gender of your doggy?
Gender my dog? No, it was actually the cat who knocked the speaker off the table. So sorry to anyone that was that had to deal with that loud noise. And now the dog's barking.
I actually didn't
Why?
hear anything.
Animals.
As you should, though. Everyone in the comments loves them.
Now the dog next door is barking. You just can't win, really, can
I'm
you?
sorry. I must be like hard to.
Sorry, everyone. Mr. Oh yeah. I hope that dog is not too loud for anyone
I
that's
actually
listening.
cannot hear anything. Your mic is very
Oh,
good.
okay. It's the fancy earbuds. Misconceptions. Oh yeah. I think that with the influx of people that are portraying and claiming to have DID online, that there was, and there might still be, just because I don't know whether it's still like this because I'm not currently searching for a psychologist, right?
Right.
But there was definitely that skepticism. There was that skepticism from maybe like two psychologists that I was speaking to about not necessarily the legitimacy of, how do I put it? Not necessarily the legitimacy of me having the disorder, but when I did bring up that, oh, this is the disorder that I have. Yeah, that sentence, but also not that sentence. So it's like the legitimacy of me having it, and then me being like, well, no, here's my previous, here's all my paperwork kind of thing.
Yeah.
But yeah, I think certainly that there has been an impact of the online society and psychologists, therapists, anything like that.
Yeah.
Nowadays, yeah, taking on clients and trying to kind of figure out, oh, is this an actual case kind of thing, or could this be something else? Because when you do have things like specialists that deal with PTSD and trauma disorders kind of thing, it can be it kind of does it's that, like, I want to say it like without sounding like an arse kind of thing, but it takes away those resources. Like if you are someone who like directly or indirectly kind of thing has the like malingering or whatever, right? It's like, and this I can get to that later, but it's like if you're someone who's on purpose or not malingering disorder kind of thing, and it would be more appropriate for you to see a different therapist kind of thing, a therapist that either specializes or doesn't specialize in things like anxiety, depression, like identity confusion, things like that, right? Versus a specialist who usually have limited spots, limited availabilities and things like that. And it is that thing of taking away those resources.
Oh,
and I think there was certainly a period when I was looking for therapists, or even when I was going to my first started seeing the specialist that I was seeing, that those things online can have that real world impact as to therapists trying to figure out like which clients am I going to onboard, like which ones is it more not like appropriate, but as in like for me to onboard as a client that I can actually help for having this disorder, rather than, oh, this could actually be this disorder and they need help from someone else kind of thing. So I think that has certainly impacted that world of things. But I think in general, yeah, the biggest misconceptions that I have come across from therapists, don't knock things off again, from therapists is that thing of like, oh, DID is just different personas in different scenarios kind of thing. And I think not from personal experience for this next bit, but not from personal experience, but I have seen people that are professionals, and not just people that are like claiming to be professionals, but people that are professionals interacting with online content, or just in general, that are spreading, I guess, harmful ideas about DID, but things are all about like, alters and stuff like that, like as in like, rather than anything else that is the multiple symptoms that the pathology kind of thing for the disorder, that it's being focused on that. Like I find that is something that is a big misconception, offline and online, mostly online, but yeah, I hope that somewhat answers the question.
I never even thought about how like it can actually alter you from being able to get help. It's just that's devastating to even consider.
Yeah, and again, like I certainly don't know whether that is
It could just because a lot of people
accurate nowadays, but it
yeah.
definitely is something that I have witnessed to an extent a couple of years ago.
Ooh.
Well, we just have like one problem animal.
Oh no, we have multiple problem children. Yeah, but thank you guys so much for asking questions in the comments. It means a lot. I do have a few questions lined up, but you guys are asking very valuable questions. Jealous pets, mine do that during online classes. They're like, how dare you have attention on someone else and not me? Oh, it was worth it. Never mind. Dude, that cat is ridiculous. Not the way he just climbed.
Here's the troublemaker. Here's
So
the troublemaker.
cute.
He likes to do this thing every now and then. He'll wake up in the morning and he'll just like touch everything. Like he'll just bap everything off of desks. He'll start like scratching at like screens. He'll start jumping up on chairs. And I don't know why. He's got food. He's got water. My bedroom door is open so he can go in and sit with the rabbits. So he can't complain about that. Like he'll sometimes run around and meow and complain when I lock my bedroom door because then he can't sit in with his best friends, the rabbits. But this morning it's open, so I think he's just being a pest.
It's gotta be then. Comment people are saying that they're jealous because you're talking to me and not them.
Now. No encouraging parasocial relationships, everyone.
Oh yeah, how do you differentiate between processing trauma and reliving it? I mean, that's a tough question.
That is a very I think.
Good question.
That is a very good question. I don't know that I have an answer for that. I think for me, when I think of reliving trauma, would be experiencing experiencing everything at once when it comes to a certain situation. Like if you're remembering, why are you like this? Hold on.
If it makes you feel any better, we can barely hear him or her, whatever the case may be. I mean, I can hear him. Y'all in the comments.
I can hear him. You're being a pest, buddy. I can just talk while I'm holding you and giving you
because like I've been following your channel for years.
Don't make me feel so old.
Old? I've had a YouTube channel longer than you, so I mean, how long have you had it?
Well, technically, the Axolotlsinatrenchcoat channel I think I've had since 2017, but I have done YouTube since 2015. I think was the first channel that I started.
That's amazing. I mean, you bring a lot of education about a bunch of different important topics. Link in description.
Oh, right. Now I remember. Talking about. Oh, yeah. To me, I think reliving trauma is definitely like the thing of being in that memory and kind of just experiencing everything, experiencing all of the sensations and things like that at once. Whereas when I think of processing trauma, I don't think it's necessary to relive the entirety of a memory to process trauma, especially when it's very well known that trauma, like a lot of the effects of trauma are stored in the body, like not just a mind thing. You know, you think of like the book The Body Keeps the Score, right? And it's very well supported in science, right? Is that my God, this cat. Buddy, I'm trying to sound smart. Meow meow.
I'm trying to sound smart.
I'm trying to sound smart, Roy. Jeez. But yeah, I think that being able to processing trauma doesn't mean having to relive all of the memories and the visualizations and all of that. It can be something, as simple as, oh, this is the reaction that my body is having to, I go outside and walk to the mailbox and I don't know, something triggers you about that, right? It's like, oh, this is the sensation that my body has for this. And just working on, processing however it is like that your therapist deems appropriate for you, personalized to you kind of thing, working through that, it doesn't necessarily mean that you need to relive all parts of that memory. Like, you can process trauma without having to do that.
Yeah, absolutely. Appreciate that.
Buddy, what are we doing? It's like walking me into the kitchen to show me something, but there's nothing exciting in there. Do you want me to show you where your food is? Because you know where your food is. That's a weird, man.
The animal lovers understand.
I had to show. He knows where his food is. I literally just walked up to the bench, put him on the bench, and he's like, "Oh, right, my food. It's here." And I'm like, "It's been there the whole time, buddy."
I'm so dead. He was just pretending. He was faking it. I was wondering, because you've been in therapy for a few years now, but there's a lot of people who have not been to therapy at all. And do you have any advice for people considering going to therapy for DID specifically?
My advice would be definitely do it, but at the same time, I know that that's not, it's not that it's not it's not. Unfortunately, therapy is not accessible for everyone, which is
absolutely, it's tragic.
So, yeah, it really is. It is tragic because it's like, it is so helpful for healing, and especially if you look at the not that everyone's timeline of healing is the same, but I'm sure, when I don't have any citations for this at the moment, but it's like, I'm sure one could argue that, the healing process would definitely be aided and shortened by going to regular therapy.
Agreed.
But yeah, I 100% would recommend that if it is something that is accessible for you, if it's something that is accessible for you to go to therapy. Like, it is, you can learn so many things, even if you think you know everything about yourself or everything about, all of your parts or your system or whatever you want to call it kind of thing, is that it is so, so helpful in being able to understand yourself and being able to understand trauma responses and triggers, and being able to kind of improve your awareness about yourself, but also about, interpersonal relationships. Interpersonal relationships you have with others, because being able to, the thing about relationships, right? And not just from a romantic or sexual perspective, but with relationships, and the way to heal those things is unfortunately but the way to heal those things is by having relationships. So yeah, being able to realize how you interact with the world around you, and a lot of that I've found has been through therapy. That being said, though, if you aren't able to access therapy, it doesn't mean you can't become more. It doesn't mean that you can't become more educated about your experience, or more understanding of your experience, or why you may react to things the way that you do. Definitely reading or listening to audiobooks, or, having, oh my God, not having cats. That's my number one advice.
Cats are important for grounding techniques, obviously.
Obviously. But I just shut the door, then he's just going to open it again.
Tuxedo cats are nuts.
They really are. So if you can't access therapy, definitely being able to educate yourself through things like research papers, or being able to, I think having a variety of sources is definitely a large part of that education, not just relying on one sole source for things. But yeah, definitely reading papers or reading books from other people with the same experience. That being said, though, if you're reading something like memoirs or anything like that, definitely look up there's a lot of websites nowadays that exist for looking up things to do with trigger warnings and stuff. Definitely do that, especially for things so complex as, CPTSD, PTSD, dissociative disorders, because a lot of the memoirs have traumatic like content and things in them, so you don't want to re-traumatize yourself by reading those things. But I found for me, like memoirs has like reading memoirs recently has been something that has really, I wouldn't necessarily say helped me understand myself, but it is just normalized, not like normalized, but it's made me feel like I'm not a complete terrible person, or I'm not this complete weirdo, essentially.
Oh God, yeah.
Being able to relate to that experience can be, it can be really helpful, to have that sense of empathy for self, because you see this situation reflected for someone else, and it's being able to turn that as, oh, I feel like this situation sucks for this person, and then being able to realize, well, this is the same, if not a similar thing that happened to me. Why can't I empathize with myself? So being able to read similar experiences, it really does help me have that empathy for myself. So yeah, definitely reading books, or reading research papers online, but those can be quite wordy. Just having a variety of sources that you can look at. And even though, like we were saying before, that people that do have the disorder are certainly more educated on it than those that don't have it.
Right.
At the same time, that's where that little, subclause of the sort comes in, is that I would still recommend reading, papers and research and things that are published by people that maybe don't have the disorder, but also do have a degree and do have an understanding on things, because, they didn't study for years for nothing. They do have that scientific understanding of things, and it can be really insightful to, get to know how brains in general work, and how things like trauma can impact every aspect of life. Like, I actually started reading a book recently called Nurturing Resilience, and it's a book about, like, it's specific to developmental trauma, which occurs, this is like a thing that occurs even in the womb phase of things, up to, I think it's like 4 or 3, I think it is. But it's quite fascinating learning about the effects of stress, like in pregnant people, and the what's the word? I can't think of the word at the moment, but yeah, the effects of stress and how they can actually lead to even things like OCD. Like, it can lead to things like OCD developing in the child.
Wow.
Because of the person being pregnant and having a large amount of stress or a traumatic situation happen to them, that can lead to things like that. And it's really fascinating, and it's quite, I really am enjoying, like, reading different things and learning about those, because I just didn't think that things like that could have such an impact on, like, that intergenerational, like, trauma as well as a thing. Like, there's just so many topics that can be learned even outside of a therapy environment.
Absolutely. I mean, I appreciate that. I was wondering, with the work and healing you have done so far, have you found that you are able to better meet needs of your alter or parts?
Like, you can say the word, that's fine. Yes, definitely. Like, being able to, I think it's that thing that comes with, like, being able to understand maybe, like, why certain parts are the way that they are, and having that understanding, or just even having that empathy, even though I can't always understand, like, well, why do you think that way? Having that has allowed me to realize that, oh, well, certain parts can't, certain parts aren't at, how do I phrase this first? So obviously, avoiding triggers, like, it's not something that is always practical or something that can be done forever, and it doesn't always, like, it's like, eventually you want to get to the stage where you don't have to avoid triggers, right? Like, in an ideal world.
Sure.
But at the same time, being able to recognize your triggers around you and then being able to say, okay, well, are there certain parts that, like, are there certain parts of self that don't currently have the coping mechanisms to deal with this? And then if that is the case, okay, let's not do this thing because that, like, it's outweighing the, what do you call it? Not pros and cons. There's a word that I'm after that I can't think of. But
I'm sorry,
yeah, being able to recognize that, oh, this thing might be too triggering for this part.
Okay.
Or if you know that, oh, this part isn't around, then, right, what are these things that I had learned in therapy to help me during these triggering situations? Or even, you know, not even related to my experience with DID, but when I think of when I go out to the shops with my partner and knowing that I am going to get overstimulated by the loud noises of people and things like that, and catering to myself in the way of, okay, I'll bring out my noise isolating headphones.
Sure.
Or I will bring my PRN, like my prescribed like Valium if I think I might be in a state where I might have a panic attack. Like being able to do that, but then also put that in place as well for individual parts. So once you are aware of those triggers or certain situations, which might be like, you might go outside, again, just a mailbox example, like, and you might start feeling sad, or you might start feeling like angry and agitated, and, you know, after that lose track of time kind of thing. And even if you don't know specifically what part had that reaction and you don't have good communication with that part, you know that whatever happened there was a trigger. And so maybe the way to work around that would be have your partner check the mail for you, or like work on ways of not having that happen, and also not telling yourself that that's a bad thing that happened, because that can just cause issues between different parts.
Right.
But yeah, being able to recognize this is the thing that happened, and this is what I need to do to manage that for the meantime. But the end goal is to be able to, you know, check the mail in the mailbox kind of thing.
Absolutely. I mean, that's a great answer, you know. I mean, I was wondering your opinion on self-diagnosis of complex trauma disorders.
Personally, I don't think it's necessarily a good thing. And I think the topic of self-diagnosis it's certainly not black and white. Like, there's a lot of nuance involved in it. And I mean that from the perspective of, like, how that person defines self-diagnosis. Like, there are people that will define self-diagnosis as someone saying, oh, hey, I think I have this, and them then becoming involved in this, you know, in this complex trauma community. And there are pros and cons to that, right? It's like, oh, okay, you think you might have this, you know. I don't think it should always be up to psychologists to know exactly what they're dealing, or psychiatrists to know what they're dealing with off the bat. Like, I think it certainly can be helpful if you are aware of your symptoms and you're aware of, like, oh, you know, I've heard of what this disorder is, you know, it could be this. From that, though, if you think that it could be that disorder, go and speak to someone about it.
Yeah.
But I think it can be a slippery slope of, oh, I think it's this disorder, and researching it to understand more about it. But then there's researching it and becoming obsessive about it, and then taking any kind of symptom that is written about this, or experience that's written about this disorder, and then internalizing it because there's that want to know about yourself, or to not necessarily like fit in, but becoming like obsessive over it and making these assumptions without getting an actual professional opinion, like that's when it becomes dangerous. Like I'm all for people understanding more about themselves and thinking, oh, it could be this and let me learn more about this. Because at the same time, even if it's not that disorder, they get to learn about something which is someone else's experience, and that can certainly help in how we relate to people in the world, right? But it is very dangerous, the concept of self-diagnosing basing off of, oh, I experience these things, and then it's assuming it's that, then becoming enveloped in these communities. And you see, like, recently there has been, I can't remember the TikToker's name, but people that have come out to say, oh, I don't actually have this. And a lot of it has to do with them becoming completely like enveloped in a community space.
Absolutely.
And just, making those assumptions, or like things like that are quite damaging, I think. And again, like I'm aware that not everyone has access to a therapist or a psychiatrist, but the reality is that it is a very complex disorder, and a lot of things with DID, like a lot of the symptoms, like with many things, like they can overlap with other things, like especially when you think of things like BPD, right? It's like that detachment, or I think technically in this space, the dissociation, but also that disassociation from self and not feeling, lack of identity,
absolutely.
right? So having that lack of identity in BPD, like I can certainly understand how there could be people, and there are likely people that have BPD, but are making that self-diagnosis of things like DID or OSDD, right? Because the symptoms are so similar.
And then, it's so harmful if you do go ahead and self-diagnose yourself, like you could be like going on a train in the opposite direction of healing.
Yeah, exactly. Like it can lead to the process of healing, you're right, being so much longer than it needs to be. And I think that's online communities in general are that they're good, but they can also be dangerous. It's like if you become too invested in a community and don't seek help or education in other sources, like from other sources, like it can be damaging. Like you can think that, oh, I have XYZ disorder, and not go and get help, not go and get an assessment, and it can make things worse for you in the long run. Like the way that you could be dealing with triggers, if you're basing it off of someone that you're watching, for example, like if you're just doing it solely based on that isn't catered specifically to you. And especially if you don't have that disorder and you have something completely different, it can be damaging. And when you think of things as well, like not even just like BPD, there are certain neurological conditions and things that where the symptoms would overlap with things like DID. Like when you think of like the primary symptom of not just like dissociation, but when you think of things like amnesia, right? There are plenty of neurological conditions that could actually be the answer
Absolutely.
to. So and when you like with things like that as well, like when it is physical, like brain, like neurological conditions, taking and I know this is probably like a very like extreme not thought, but it can be a reality that if you are self-diagnosing with this medical with this mental health disorder, if you're self-diagnosing with this, but actually it could be better explained by a neurological thing, like physically that's not good for your health at all. Like you could be treating one thing and it be completely different, and that being more damaging to your actual physical brain health, right? But just in general, there are a lot of things that overlap, and a lot of personality disorders, like on the cluster B spectrum of things, that overlap with not even just DID or OSDD, but also just PTSD and CPTSD in general.
Absolutely. Yeah. I mean, a lot of cluster B is caused directly from trauma.
Exactly. Yeah. So I think there's a lot of danger that I believe is there when it comes to self-diagnosing, but also it depends on how one defines self-diagnosis. Like I said, like people seeking out a sense of community and like-minded people, that's just how society and the world works. And I do think that it is helpful in some ways to have that sense of community, but also because it is a complex trauma disorder, when you aren't dealing with what you think that you're dealing with, it can be more damaging to your own mental health. And in turn as well, obviously that impacts that can impact other people that you might be interacting with and their own sense of, trust and safety kind of thing.
Yeah.
So yeah, I'm not exactly pro self-diagnosis for complex trauma disorders. I think that people definitely should go and get things looked at, but I'm also people should educate themselves regardless of whether they have the disorder or not. So I think people looking the disorder up, great, like get to know more about it, get to know more about what the people, that have this disorder are experiencing, whether that is you or not, but also don't obsess over it and claim that you have this experience when you really should become not obsessed, when you really should gain access to help for what you suspect that you might have.
Yeah, absolutely.
Mm.
I mean, to switch the rails a little bit, what was your first symptom that you noticed of DID and how old were you? Or probably CPTSD.
So like first symptom, like if I think back on it now, or do you mean like first symptom that like kind of red flagged me that I had to get,
Yeah,
like that I
guess
used to get look at?
red flag?
I mean, I think the first red flag probably would have been the nightmares that I was having and my day nightmares, so my flashbacks. I think that would have been the first red flag because that was something that was quite regular for me to have. Like when I was like in teenage years and things like that. But yeah, I think there were like a couple of things. I mean, I think that would have been it, and not remembering my childhood, like when I had hit like 10, 11, 12, like that kind of thing, like just not remembering my childhood were things that I I definitely noticed, being like, what was I doing a couple of years ago? I don't know.
Yeah, absolutely.
Yeah.
I mean, is there any specific exercises or techniques you use in therapy to enhance communication with different parts?
So recently we started doing, what was that? Like practicing for EMDR is that my therapist had me write out, like, well, not necessarily write out, like, take note of in therapy, like a list of different parts that might be helpful to have around, right? And then from there, during like when doing EMDR, and then from there was a session where we were doing what do you call it, bilateral stimulation, which is like the tappy thing or whatever it's called, and doing that not necessarily while processing trauma memories. It was a way of trying to get a certain part to be around, so then we could keep practicing that, and then when those trauma memories come up, being able to kind of bring them forward, kind of thing. So we were doing that in therapy with the tapping thing, and she was having me kind of do that first thing of like visualizing like a safe space, and then visualizing this certain part in this safe space and what they are like discussing like during that bilateral stimulation, like what the certain part is like and how it feels to be in their presence. Like is it something that feels warm? Is it something that feels like the sunshine, like things like that, right? And that was something that really, like, it definitely did work. It was really interesting when I was listening back to that therapy session, because I like record my sessions and stuff. It was interesting listening back to that and hearing that change, that switching, as like she, like as my therapist, like as she kind of brought them forward, brought this particular part forward. It was quite yeah, it was really fascinating to listen back to.
Wow. I mean, can you describe, I mean, I don't know if you would want to answer this, but can you describe the process of what it feels like to switch?
Oh gosh. Well, in that instance, it was very, how would I describe it? In that instance, it was very slow, like it was quite gradual. Um, yeah, it was very gradual. We
Oh, God.
like, and not necessarily like in a bad way. It was just kind of
Oh,
this feeling of picking something up out of like kind of out of like when you get that like kinetic sand kind of thing, like picking something up out of like kinetic sand and then like placing something else back down. It was like very this like kind of like slow, soft kind of feeling to it.
but not
Um,
uncomfortable?
no,
Okay.
and that's yeah, it was quite interesting because there are like when switches typically happen, for me at least, like when it has to do with triggers, is that there is a feeling of like yeah, uncomfortable, or it can be quite disconcerting, is there's just that like it's more like being stuck in like just this like thick kind of like gluggy goop kind of feeling. Like it just feels like that same, like that same pulling and like replacing kind of thing, but they just feel very different. Um, yeah,
Wow.
because if there are long switches when it hasn't been, in therapy, for example, like it does definitely feel like that unstuck, feeling 95% of the time. Or if there are like short or like medium, I don't know how one would determine that, but switches, they can be, it can just be just simply like uncomfortable because it's like you're existing in um both spaces. Like you'll be existing in one part space and another part space and feeling very confusing and conflicting emotions about the world around you because of how each part may perceive things. Um, and like it can be difficult, when it comes to things with my partner. Like we'll be hanging out and different parts feel different ways, kind of thing. So it will be this weird thing of it feeling like a romantic relationship and then like just this weird uncomfortable like friendship, and just like both of those spaces kind of existing at once. It just feels quite uncomfortable and quite confusing at times.
I
Mm.
mean, I don't know. This is out of my personal curiosity. Like, how does it? Are you? I don't want to use like I don't know. Or do you feel any certain type of way when you switch? Like, oh, I don't want to switch, or it's like a sneeze. Like, oh, thank God.
Still the worst.
Is that bad?
Like a sneeze, is it, Michelle?
I don't know. Why would I? That's just what I've heard from other people.
If you know, you know. I think it's
Oh.
there are there are certainly times when I don't want to, like I'll be doing something, right? The cat's doing a part, what do you call it? A bag. I hope you can't hear him. If you can, let me know, and I'll scurry him off to another room.
I think
What's the
it's okay.
question?
No.
Switching. Oh, right. Yeah, look, sometimes I'll be doing something, or more in the past, like not since there's been like a lot better communication over the past, 2, 3 years or whatever, but it has definitely been a thing of feeling very uncomfortable. Like I'll be doing something and then I'll notice another part is around, I'll start yawning, I'll start dissociating,
Oh no.
and even though I'll try to ground, I'll know that I'm out of that window of tolerance and that I'm, losing that ability to, what do you call it? To have that, like to be able to
Yeah.
ground myself essentially. And yeah, I just I'd just be so frustrated at the fact that I know that a switch is going to happen, and I'll be like, but I'm doing this thing, like I'm trying to do this thing. I don't want to share this space with another part. Like this is what I'm doing. And it just feels like that, not like a hijacking kind of thing, but in a way it kind of does. And I think I had a problem with that a lot in the past, but I think nowadays, if that is happening, I have more of an understanding of, oh, well, this might be why this is happening, or this is how I can ground, or we're all parts of one individual self. So I and not feeling angry or mad or a sense of distrust that another part is going to front, because I think a lot of that is obviously rooted in trauma and feeling like, you know, not necessarily something's being taken away from me, but it's that feeling of like that lack of sense of agency, that lack of consent, so to speak. And so, yeah, being able to recognize and process it, oh, you know, we're all parts of oneself, and there's no kind of inherent like distrust going on here, is also something that has made switches that do occur that I'm not able to kind of get back in control and ground, because not that you can control switches, but also switches happen during dissociation, and in order to, you know, aid dissociation, you ground yourself, so therefore you can potentially avoid a switch, right?
Yeah.
But yeah, so being able to work on those things certainly makes the concept of switching a lot less uncomfortable in the situations that it does happen. Yeah, but in terms of physical discomfort, for example, it can be difficult because it can be quite draining, and depending on which part does switch out, I can get like, you know, I can get a headache or I can get a migraine, because obviously the brain is just doing its brain thing of working overtime and trying to deal with triggers or dissociation or any of the you know, somatic, like the body memories that come along with whatever the triggers are. And so my brain will just get overwhelmed with all of that, and I'll start getting a headache or a migraine. So that part of switching can be uncomfortable. But again, that doesn't happen majority of the time for me. That's just during certain situations or certain triggers or with certain parts being around. But from that as well, there's ways to mitigate that, whether it be through having like some paracetamol, or making sure I'm hydrated enough, or having a nap, or listening to some calming music, or keeping my headphones on. Yeah.
I mean, like, do you know any specific reason for switches, or can it just happen for seemingly no reason?
It's my opinion that switches always have a reason.
Sure.
I'm, you know, not an educated scientist on the fact, but usually it is due to a reason. You might not always know what it is. Like, yeah, you might not always be 100% aware, like, that it could be this trigger. But from my understanding, that's why switches happen. And it can be something as small as like your brain remembering something traumatic that happened to you, and you saw a green leaf shaped in a certain way outside when the trauma was occurring. And then years later, you see a green leaf, and then your brain is like, just takes that visual memory and it connects it to this thing that happened.
Right.
And all of a sudden you're dissociating, or you're having a flashback. And, you know, flashbacks aren't, you know, the clear cut and dry of the, oh, it's a visual flashback. You could be having an emotional flashback, right? And you won't know, like, you won't know that that's the leaf that triggered you.
Yeah,
like, you might not ever know that, because you're not always going to have like all of like your memories like come back, so to speak, if you do remember things like later on, like, because memories they're not stored all in like one little compact little box of like, you know, visual, auditory, like all the senses. They're not kept like that, right? But yeah, you won't always realize it. But I'm of the opinion that, yeah, switches do typically happen due to triggers. I'm talking about like involuntary switches, right? They happen due to triggers, and you might not always know the reason. Voluntary switches, I don't really have much experience with. And from my understanding it's again, majority of the time it happens after you work on that in therapy. Like it's very small, very small. I can't even say percentage because I don't have anything to back that up, but it's very small amount of people, from my understanding, can just voluntarily switch in and out without already having had worked on that during therapy.
Okay, sure.
Mm.
Thank you. I mean, there's so many different routes that a person with DID can take in the therapeutic approach. Like, do you have a plan of integration, functional multiplicity, or you don't know?
Yeah, I think at this point, like I'm pretty sure maybe already I'm at functional multiplicity, I think.
Sure.
I don't even remember how that is defined technically, because that's like when there's that integration and like the lowering of those barriers. So I think I'm pretty much at that point now. Like almost, I'm probably like 95% there, I think. But for me, I certainly wouldn't be opposed to final fusion. I think what I found, like it's something that I do wish to achieve, but at the same time, I don't. I have I have a very large fear of failure, due to trauma or otherwise,
Sure.
right? Is that I want to tell myself that whatever happens, happens kind of thing, because I feel as though if I do set that goal of integration, final fusion kind of thing, sorry, let's not mix up words there, but if I do set that goal of final fusion, that if I don't achieve that, or if I don't achieve that in what my brain determines a suitable time frame, that I'm, there's just going to be a lot of that like internalized, like, hatred or like feeling of not being good enough kind of thing.
Sure.
So yeah, it's certainly on the cards, on the table, whatever the saying is. But I'm also not pressuring myself to do that either. I'm like, that would be great. I would love for that. But also if that doesn't happen and I just achieve functional multiplicity, that's fine too. So I'm working towards final fusion, but I'm also open to, if it doesn't happen, that's fine. Also, chat amongst yourself. I do need to go to the bathroom, so I'll be back.
Oh yes, please. I was about to be like, you need a break. I mean, I figured I'd read some of you guys' comments because y'all be hitting me up with what switches feel like for you. I understand it's not as educational as it could be. That was out of my curiosity. But Gothic Owls says that they see a bright light and like an aura with their switches, or migraine. There's multiple people, like 4 people, who are saying that they get different types of headaches, which, I mean, I would just love to get down into the scientific reason for switches and what parts of the brain are working together and why it causes a headache. Switches can vary from mid-sentence to having to cover my eyes to major headaches, etc. For us, oh yeah, also you guys, I'm low-key almost out of questions. Don't tell axolotls. But if you have any more questions, let me know, because I don't know like if I should keep them or not. But anyways, so there's people saying that you have different types of switches. We're talking about people's experiences with switching, and a majority is saying that it's caused by a major headache, or I mean it causes a major headache.
What did I miss?
We're just talking about, I figured I'd read aloud some people talking about what switching feels like for them, and they're all saying it's like a major headache. It's not all of them, obviously. Everyone's different, but a lot of people.
Gothic Owls, yes. Yes, I also have that.
Like the aura headache?
I also have fibromyalgia. What? Oh, no. I get what do you call it? Um, I get visual migraines, but I don't think that has to do with my DID. I think that has to do with my fibro or my POTS. I'm not sure.
Oh, okay. I mean,
Um,
I would love to talk with you about that sometime too.
yeah, I was just reading the comment, Gothic Owls Misfits saying anyone have fibromyalgia too. I was just like, well, yes.
I mean, I don't even know that much about it, so anytime you would like to educate.
Okay. Fibromyalgia. Right, I
Feeling
don't
on the
have nearly
spot.
enough education about that one.
It's like,
I just know that I have it. It's similar to, what do you call it? It's similar to chronic fatigue, except for the main differentiation is that one is predominantly fatigue based, obviously chronic fatigue syndrome, and then the other one has to do with what do you call it? Muscle pain. I think
oh,
there's a specific word that I'm trying to think of that I can't think of at the moment. But for me, fibro, it's like I'll, for example, like the other week, I was doing my partner's hair, and I like because she has really long hair, like I'm talking like down to like her hips
so
hair.
cool.
And so, yeah, we were dyeing that, and I had to be standing up for like hours. And my muscles at the end of the day for the next maybe like 2 days were just so sore. It's just this painful, dull, achy sensation. And if I'm sitting at the computer for like couple of hours and things like that, like I'll start, and if I've been like typing and things, like I'll start to feel it like all like up my arm kind of thing, and I'll start to feel like just tightness and this muscle pain. um yeah.
Okay. Um, I mean, Madison is saying that I understand because I want Final Fusion so badly, but it's a lot of pressure. Final Fusion helps with
Mm,
dissociation, and you're less likely to develop new alters, but functional multiplicity comes first, of course. That's fair. Healing is, you're going in the right direction.
100%, 100%. And healing also, like it's not it's also important to remember that it's not linear, that you may have progress in certain areas and then something may come up for you and you may feel like you've taken a backward step. But the fact that you're even, I don't know, in my mind, the fact that you're even able to recognize that, oh, I used to be able to deal so much better kind of thing with this thing, it's not a sign of you going backwards. The fact that you can recognize that you maybe had these tools that you could cope with in the past, but you can't now. It's like having that introspection in my point of view is still progress in itself. Like being able to recognize that, oh, these changes have happened in my environment or the way that I react to things. Like that's still like it doesn't mean you've taken a step backwards, or that if there have been more fragmentation or more splits, it doesn't mean that there has been a step backwards. Your brain is still,
Sure.
it's healing is all about like rewiring your brain, so to speak. So being able to help the brain understand that it doesn't need to resort to fragmenting, to splitting when something traumatic or major stresses are happening in your environment, that because it is so it's a learned coping mechanism and coping response to trauma. And so it's not just as simple as being like, oh well, that's not going to happen anymore. You need to rewire your brain and give your brain other methods of coping and ways of feeling safe, so it doesn't feel, that state of like hyper arousal, that fight, flight, freeze, fawn, feign. I think they're the ones.
Right, right.
Yeah, so it doesn't feel that and feel the need to continue fragmenting. But also, if it does happen, that's not. It doesn't make you a bad
You're
person. It
not a
doesn't make.
failure.
Yeah, you're not a failure. Exactly. Like it's just a thing that happens, and
It's
you
not your
just
fault.
got to keep on working on it.
Yeah, I think that's great. Eva wants to know, what do you do for strategies for those freeze responses to memories? if you experienced?
Oh yeah, freeze is definitely up there in my my top responses that I tend to have. Over time, like, and I suppose that's why they call it the freeze response, right? It's like that feeling of the tightness and just not feeling as though I can move, or sometimes like I can't get the words out when I'm trying to explain to my partner, or my care worker like what I'm feeling, or my therapist kind of thing. But being able to just exist, like, so sometimes something as simple as just being able to exist in it, to start off with, like, take things slowly, like don't set unrealistic expectations that response that you're having is going to be that you can just switch it off. Like there are all these little steps in between. Like for some people, things like breathing exercises during those times work. For me personally, it has been, again, it comes back to my preference of like things like somatic responses, like being attuned to my body. And when I'm stuck in that freeze state, and if I feel that I can't move, or I feel that I can't really say anything, is to just kind of sit and notice where I'm feeling things. Sit and notice, oh, am I feeling, tingling in my legs? And
Wow.
try and just focus on that one thing and notice it, focus on it, maybe try and like see if I can wriggle my toes, like just small things. And then over time, I'm able to kind of not only recognize it and feel that and do that thing, but then I think, oh, I can also notice this other thing. I can notice this is how I can feel how my heart is beating, and incorporate that and just pay attention to that, and gradually over time use that to ground myself, even if that amount of time takes 10 minutes, even if that amount of time takes hours. Like, even if I, am struggling and I can't keep having that achievement anymore, I'm like, well, okay, it's time to have a nap. Obviously that can be difficult if you're in a situation where you can't just go and have a nap.
Sure.
But trying to have that, provide those accommodations to yourself and not be so hard on yourself. Like, that's something that I found has been useful, is just taking it, that cliche of like one step at a time, but just those small things, and not trying to aim for, oh, I'm not going to experience this freeze response, because it makes things feel unobtainable when you look at that very end goal, rather than looking at these small goals, and also giving yourself a pat on the back for when you do recognize those things, even if they are small, and even if you think, oh, well, this is, other people would be able to do this easily. Like, try not to compare yourself to others. That's the hardest thing that I've also found over time. But being like, this is an achievement, even though to some people it would be little. For me, this is a big achievement, and I am proud of this, and trying to reaffirm that, but then also have people like my partner reaffirm that to me as well. Like, even if they are small things, like being able to ask her like, hey, this is how I'm feeling, and this is what I'm feeling about, whatever's happening, and have her reassure me that, oh, good job on, and not even to do with things like between the two of us, right? But just in general, communicating that, and her being like, good job and recognizing that. I'm proud of you for doing that. Yeah, that's been quite helpful for me.
Great. I mean, have you ever, in therapy, learned about the co-consciousness or improved on that?
Yes and no. Like, it's something that, I mean, I kind of like had a base understanding of that prior to therapy. But in therapy, like, even with my specialist and now my current therapist, I focus a lot more on the trauma responses, and then second to that would be the parts work. So I think the whole thing of co-consciousness isn't it's not something that has been explored directly. It's rather been explored indirectly. So kind of we'll be discussing one thing and noticing that a certain other part might be around and pointing that out to my therapist, or a lot of the time she'll notice when I do start to dissociate or kind of trail off in my own mind, or she'll notice that another part is potentially around because I'll start getting distracted by things. But being able to say, hey, I think this part is around, or I'm experiencing this emotion, but I feel as the part that is out fronting whatever at the moment, that's not connected to me, so I think it is connected to another part. Being able to set that as a co-conscious kind of thing, like discussion of like, oh, okay, and my therapist will ask me things like, you know, is it okay that you're noticing that right now? Like my therapist is very big on, you know, reiterating like that I have that choice in therapy of whether I do want to talk about certain things or I don't, or whether I want to not talk about like that thing of like autonomy and consent kind of thing. But so she'll ask me like, oh, is it okay that you are feeling that anxiety right now, or do we want to work on grounding, or do we want to change the topic kind of thing? Or she'll be like, okay, well, can we just sit and be curious with that, you know, that emotion of anxiety or anger? What other things do you feel along with that? Or I'll say, oh, like this is the emotion that's kind of coming through, or this is the phrase or collection of words that are coming through, or maybe if I'll have brought something up and then my mind will get distracted by something related to something that someone had said to me when I was younger kind of thing, and I'll say, oh, my brain was just distracted because of this, you know, phrase that came to mind, and then we'll kind of explore that, and then there will be times where there is that input from other parts. But yeah, it's certainly never been a direct thing that we have been working on in therapy, is that concept of co-consciousness. It has been as a result of talking about something else and then kind of acknowledging that along the way.
Sure. I mean, we'll wrap up soon. I can't imagine you're probably getting tired. I mean, have you ever experienced setbacks when it comes to therapy, and how do you overcome the setbacks?
Like you mean setbacks like for like within therapy itself, or like in life in general, and then having that impact like where I wanted to. Okay, my brain's just going to go off on that tangent. So I had like my goal in therapy, like one of my goals in therapy was working with a particular part who she's still around at the moment, but she was predominantly around at the start of the stream, was working with Mila, and she, like, as a collective, like I had this goal of working with her through a lot of or allowing her to work with my therapist with a lot of the trauma memories and things like that she holds. But I ended up getting, I think about almost 2 years ago now, I ended up getting a dog because I wanted to train her to be a service dog to help me with dissociation and autism.
Yes, I remember.
And
this.
yeah, and so I got a German Shepherd, and I hired a trainer to help me to train her, and that was going well up until Kira, like my German Shepherd, was, I think, I don't know what age it typically is when dogs like typically like go on heat kind of thing. And so she was very hormonal, and she was very vocal. Like she would bark a lot. And this is when we were living in one of the old places that we were living at, but still in Sydney kind of thing. But there was a dog next door that was very, I wouldn't necessarily say aggressive, wasn't in the best living conditions, but that dog, like she would bark at Kira a lot. And so Kira never used to bark, but because we'd moved to this place, like she started barking back at this dog that was territorial next door.
Sure.
And even though my goal in therapy was to be working with Mila on her trauma memories, all of that was on hold for about a year because Kira barking brought up all of these memories for me of the abuse and stuff that my dogs went through, like during childhood, that like like obviously, you know, dissociation and amnesia, that I completely didn't even remember, or what I did remember, it was very brief, or it was visual, and there wasn't that emotional connection to those memories. And so when Kira would be barking at this dog next door, like all of a sudden all of that was brought up, like all of that experience and all of that experience with that particular person that was abusive to these dogs that I had during childhood, all of that was just dredged back up. So I had to deal with this trigger that was actively like part of my life and in my environment. And so therefore I couldn't, you know, deal with the things that I was, you know, that were my next goal in therapy. So for a year I was kind of just barely getting by, like mentally, because I was just struggling, because day in, day out, like she would just be barking, the dog next door would be barking, and it was just such a struggle. So for me, it felt like such a setback, because I had this idea that this is the thing that I was going to work on next. And it can certainly be difficult at times when there are things that come up, but that's just how life is at times. Things will come up, and life will just, you know, things will just take a different turn. Not necessarily saying it's for the better or for the worse, but things change, and it's important to have, like, it's important learning how to have or be okay, or just even sit in, being able to adapt, or being open to the idea of things changing, which is obviously very difficult, especially if, you know, there's not a lot of security in change. And, you know, if you do have trauma, especially like complex trauma, like things changing is just a huge thing in and of itself. But I think over time, me being able to feel comfortable with the fact that things may come up, and that may alter my healing journey or my healing process.
Sure.
And again, that thing of recognizing, and it's easier said than done, but of recognizing that healing isn't, or the recovery, right? That healing isn't, it's not linear, and we kind of learn more about each other and the way that we, like, as in like general we, right? You, me, everyone, right? We learn more about each other and the way that we interact with the world around us as we go. Like, there's that thing of like, you learn something new every day, but there's always something that you're able to learn and pick up on about yourself in therapy, and in practicing those therapy techniques outside of, you know, the therapy office, the therapy environment.
Amazing. Absolutely. I think that is so important for people, even without DID, specifically CPTSD, to hear. Okay, last question. In your experience, how has therapy for DID, CPTSD influenced your overall well-being and quality of life?
Immensely. Like I don't even know what I would kind of be like if I wasn't in therapy. Like, words to describe. I feel like I'm more capable of doing things, and not even just like, oh, going outside and going into large crowds. Like, I struggle with that due to other reasons, but I think a lot of everything, it just comes down to introspection and being able to understand yourself, because from there I can I've learned how to better accommodate myself in situations, or I have learned how to communicate in the relationships that I have in life, whether it be with my partner or whether it be other interpersonal relationships with a friend or with, I don't really talk to any of my family, but like with a family member, like things like that, being able to understand things and to recognize when I'm outside of my window of tolerance, being able to understand certain things that are triggering, or understanding things that are trauma responses. Like they're all things I've learned within therapy itself. And yeah, a big part of that, like it does definitely come down to those interpersonal relationships, especially, when you look at things from a trauma responsive romantic or sexual things, like that kind of stuff, and being able to work in therapy on like pointing the finger outwards kind of thing, not feeling as though everything that did happen to me was my fault, like recognizing that things like, CSA, like they're not my fault, like being able to point that finger outwards and ask, well, where were the adults in my life when this was happening? Or where were, why wasn't I being validated for certain emotions? Or why wasn't I being taken care of? Or all these things, being able to not think that this is my fault. I got myself into this situation, when it's just like, no, I was a kid, and being able to do this is definitely something that I've learned through therapy. And I'm really only been making progress on the whole, like things, well, not like progress, but seeing tangible like progress on that pointing the finger outwards, even in the past, I think like week or so. But yeah, being able to have therapy has really been useful, and I find that it has certainly helped me grow as a person and understand more about my trauma and my trauma reactions or responses, and then obviously, in turn, the different parts of self, and have that working together to be able to function, as they call it, to be able to get through daily life.
Sure. Thank you. I mean, is there anything else you wanted to add or like plug anything? Or?
Not that I can.
YouTube.
I'm thinking.
Sub.
I sub to my YouTube Axolotlsinatrenchcoat, except for
No, seriously though.
I don't really post. I don't really post on my YouTube a lot anymore.
That's okay.
Just due to online community things, like the online DID community just gives me the ick nowadays. But no offense to those of you who are part of it. I just not for me. Been there, done that. I had a lot of I don't know, something that I hope I'm not rambling too much, because it's like nighttime. You're
incredible.
Because something that I wanted to point out as well, I guess it's something that was difficult for me when I was involved in the community and since leaving, and I think I spoke about it in a couple of videos on my channel, but that large focus of the disorder being about alters, or the differences between different alters, and that being so focused on, I found, again, this is just personal to myself, but I found that it wasn't helpful for, like, being so involved in that environment and so obsessive over alters and alter differences. It wasn't like, it certainly put a bit of a pause, or it slowed down what my healing process could have been like. And I think that comes back to what we were talking about earlier, of the, that self-diagnosis, or becoming so enveloped in these kind of communities, as it can set you back, so to speak, to become obsessive over this one thing. Like, even though, while in some cases it can be it can be useful to know about your parts, about your alters kind of thing, because it does help you in certain situations of mitigating triggers and things like that. At the same time, for me personally, I found that being so obsessive over alters and alter differences, it did lead me down that road of I think that constitutes as malingering. Like, malingering is a very broad term. It doesn't mean that someone is like,
right,
oh,
like
you're faking
fake
this
because you
it can
exaggerate.
Yeah, exactly. Yeah. So malingering can include things like exaggerating. And for those of you who have watched my videos before, I have talked about this, but like and it's something that I'm definitely not proud of. Like I give myself the ick with this, but it's like I was very obsessed with like thinking, well, if this person says that they have the disorder and this is how they're presenting, and that therefore means, like, if that's not how I'm presenting, I therefore don't have the disorder, which therefore means I don't have this trauma, and I'm a terrible person for making up this trauma about this person from my childhood, that abused me, kind of thing. And it was like, it would like come from that thought all the way down to there. So I think, well, if I am behaving in XYZ way like this person, then therefore I must have the disorder, and therefore my trauma must be real. So I would, definitely act up, kind of thing. Like, yes, there are definitely alters in my system. I don't really like that word either, but there are definitely like different parts of myself that are different. I would say that I am overt, not covert, but there are parts of myself that are different for sure. But there was definitely that exaggeration of those differences, that being like, oh well, they need to have like, all these different like likes and dislikes in order to be completely different from one another.
I mean, I appreciate you sharing that, because, like, as a person without DID, I have no idea what's exaggeration or not.
Yeah, no, there was definitely a time where I was doing that, and that's like I used to have much more videos on my channel than I do now, but I deleted a lot of them not because I'm afraid of running from, like, not that I'm trying to run or hide the fact that I did that, because, like I said, I have talked about it in a couple of videos that are still on my channel, obviously. But I don't want people to get the same idea that I had, people that are, vulnerable because they are early on the healing journey, early into figuring what the hell's going on in their life, right? I don't want people to see that content and go down that same rabbit hole kind of thing that I did, and think that that is what the disorder primarily is. It's all about alters, and alters are all different. And that, all cases, the majority of cases of DID are covert, because that's not the case. And I just think things like that, like portrayals like that, can impede healing, like that sensationalizing of the disorder, or that romanticizing of the disorder, that sole focus being about alters. It just creates, like, I feel like online, like in the online, whether it be like in the community itself or just the online sphere, right, of people knowing about DID, it has gone from working on, like, the initial goal when, like, like when people like first started, like when I think of, like one of my friends, like, Jess, like multiplicity&me, right?
Yes.
It's like when her and Encina Severa, when her and Encina, because they were like, I think the first two that like started channels like back like 10 or so years ago, and then they went away for a couple of years and then restarted their channel again, kind of thing. But when I think of brain, where were your thoughts? Brain. Damn it.
I'm surprised you haven't done that already. You've been amazing.
What was I thinking? Oh yeah. So I think like when those channels started, like there was that that want to destigmatize the disorder, and what was generally thought about the disorder at the time was like it was that big stigma of people with DID are murderers and all of that stuff, right? So I think we've gone from that, but like during the past like 10 or so years, the pendulum has swung due to the influx of creators online, or the influx of things being like COVID, right? And like a lot of COVID kids, like as in being inside and being online, and yeah, exactly, like it's gone from destigmatizing and like it being dangerous to the stigma now being, oh, this is this magical, like fantastical disorder, like, oh wow, all these alters that I can talk to and people in my brain kind of thing. So yeah, the pendulum's like gone from like danger to just romantic,
Which one
wondrous.
would you prefer, over glamorization or assuming everyone is a murderer? I shouldn't ask that.
That's a very good question.
Like neither would be ideal, somewhere in the middle.
Neither would be ideal. I think somewhere, I mean, obviously, yeah, just in the middle, like just, yeah, neither of those things, just the general realization that it is a disorder rooted in trauma. It's not something cool or quirky to have. At the same time, it doesn't mean that people with the disorder are bad people or necessarily like cringy people or whatever. Like it doesn't.
You're just being yourself.
It's how they. Yeah, exactly. It's like it's just how their brain, like how our brains cope, kind of thing. But yeah, I just wish that there wasn't such a glamorization of the disorder or this. I think online now there's a big oversaturation of that overt freaking words. Yeah, that there's a big oversaturation of the overt presentation, and in a lot of cases of the overt presentation, it is by those who have self-diagnosed, and those things together do become a problem, not just for general society speaking, right, but for the people themselves and their own understanding of whether or not they do have this disorder, and if they do and they are overt, like their healing process, like it just impacts a lot of things. So I wish that wasn't the case online. I wish that a lot more people were focused on it being a trauma disorder and the effects. Like I wish people were just more focused on the CPTSD aspect of DID rather than the I from the DID of identity kind of thing.
That.
Like, which is what I try to do, like now, like not necessarily just to try and make up for my my mistakes in the past of over sensationalizing things, but to try and provide that perspective to people, because I haven't found that there is a lot of content out there that does discuss the therapeutic process of healing from a complex trauma disorder such as DID. And obviously that's for, myriad of reasons, especially discussing one's own therapy journey. It's a very vulnerable and difficult thing to do. But I was like really inspired by reading some memoirs lately. Like I read a memoir last year, book collection on my desk, like it's called What My Bones Know.
Yeah, like I actually wanted to ask you to link a lot of stuff in the description that you just enjoy or find helpful.
Oh, definitely. Yeah, my rabbits chewed this. This is technically a copy. No, come on camera.
Oh, yeah, I'm like, I would love to see this right now, but
there we go. Yeah, it's called What My Bones Know. My rabbits have chewed it. This is actually my therapist's copy because she loans me some of her books and stuff, except for then I bought her a new one because I was just like, I'm so sorry that my rabbits have chewed this. Please, I'll buy you a new copy. But the lady that wrote this, like the author, Stephanie Fu, she doesn't have DID, but she does have CPTSD. And I was really inspired. Like I would 100% recommend reading this, although trigger warning in this for physical abuse. So for me, this wasn't triggering because that's not the nature of my trauma. I've discussed that on my videos and stuff in the past. I do have my history is CSA. It's not physical related abuse. Well, not as in, you know what I mean.
Yeah.
But yeah, I found it really inspiring, like the way she talked about being curious when it comes to her emotions and her healing process from trauma, and from reading that. And how she was saying in some of her later chapters about how she was recording therapy sessions and stuff with her psychologist at the time. I was like, I didn't know that you could do that. So I spoke to my therapist, and she said that she was more than happy for me to record my sessions and publish them. So I've been posting on my website, axolotlsinatrenchcoat.com.
Cool.
Yeah, so I post on my website my therapy sessions. Like, I take the time to, like, obviously listen back to them, because I do it anyway, like just to listen back myself, so it helps me really gain that understanding of different parts that may be present during therapy, and their views and opinions. And obviously whatever I publish on my website is okayed by those certain parts that maybe were feeling vulnerable, like Mila, for example. A lot of the most recent sessions are ones that she's been at. But I take the things and I edit it in Filmora, like I crop it down, because my sessions are like an hour to 2 hours long kind of thing. So I just crop down the main bits, and then just transcribe it and chuck it up on my website. So that's a thing that I've been enjoying doing, because I think it's
So important.
Can be really helpful for other people to kind of see behind the curtain what the healing process can be like for someone with PTSD, and especially because I am at a point where I wouldn't necessarily call it a privilege, but like I'm fortunate enough to be going to therapy. Like I go to therapy. I was previously having sessions twice a week, but now, because I had like a schedule change that ended up unchanging anyway, I go to therapy once a week, but it's the same amount of hours. So I do therapy every week for 2 hours, and that is very draining. But it's it's worth it. Having therapy that frequently, like when it was 2 days a week, 1 hour each, like that's probably something in the past year, because I think that's how long I was like having those amount of sessions, that amount of time. I wouldn't say it necessarily like fast tracked my healing, but it made a hell of a lot of a difference. So I'm fortunate to be qualified disabled enough through Australian healthcare stuff to be having my therapy sessions funded by the National Disability Insurance Scheme.
I'd say that you're getting what you deserve. If ever anyone else doesn't have that, then it's sad. You know what I mean? It's not a privilege. I don't know how to describe it.
Yeah, it's a privilege to be disabled.
Yeah. Absolutely.
But yeah, I mean, if you have any other questions, let me know. Otherwise, I'd probably talk to your ear off for a while, and then.
I mean, I personally don't, but I would love to like go live in the future, or make a video, or just collab about something, because like fibro, CPTSD, other disorders you struggle with.
Postural tachycardia syndrome, autism, bipolar type 2.
All of them.
All of them.
Yeah, I mean, recording sessions, I've heard a lot of people do that, so.
Yeah, well, everyone, you should go check out my website, because, like, you'll, like, hold on, like, let me, wait, turn on your, host participant screen sharing. Turn it on.
Oh, you could screen share this? That's cool.
Yeah, but you need to turn it on your end. On the little button that says, there's a little button that's like screen sharing. Oh my god, Kitty. Kitten. Little kitten. This is so cute. Your cat looks like me when I dissociate into the void.
She's like, I would really appreciate it if you wouldn't do, like, she thinks it's an alien.
She's just like, hello.
Oh, really?
Blurry app.
Sorry about that. I did not know that. that I'd have. Oh, never mind. Yeah.
I'm just reading the comments. But yeah, it was really nice for you to have. Oh my God, brain words. Thank you for having me.
Thank you for having me.
I had a good time.
Yeah, you are so well spoken.
Yes, I'm so good at being enunciating and focusing. See, this is
like
example. It's like switch call and camera. No, example of you. I probably sounded a lot more coherent at the beginning of the stream because a certain other part was around. Whereas now I'm just like words. What a word and sounding smart. Teehee. But yeah, if anyone is interested in learning about or listening to my therapy process and stuff, then Axolotlsinatrenchcoat.com is my WordPress site, which everyone go look at because I made it look all pretty and stuff.
We will.
So then it looks all pretty and stuff. I hope everyone like you should put on screen share so then I can show everyone now and then everyone can just be like, oh my God, you're so wow.
I could totally show them if you send me a link or email.
Well, yeah, otherwise you can literally, on Zoom itself, there's literally a thing that says screen share, but like it's an option that comes up on your hosting end that says allow participants screen share.
Oh, you could why can't I already do that? Allow multi-pin, I don't know.
Yeah, I don't know how things work. It's like down the bottom and they're like, it's like mute, stop video, participants, chat, screen share. But I think it's like the participants and then allow screen share.
Allow participants. I'm sorry.
Why do you hate me? That's fine.
But I'm sure there's a way to do it with things. Report.
With things and stuff and things.
Maybe not report you. What if I made you the
host? Tap so screen to display the meeting controls, more than security, then screen share to enable screen sharing for participants. Catch all that?
Did it work?
I don't know. Yes it did.
I was like, that's a lot of words.
That's a lot of words and stuff and things. Is this showing up now? Yes, it should be.
Yes, I'm seeing it. This is so cool.
Lovely. Yeah, so this is my WordPress account. So I've got my cute little thing that says stuff about me. Like everyone that like give me all the freaking pats on the back for the fact that I made this all by myself.
This is the Axos. Oh, this is beautiful. Well done.
Thank you. And then my little main page, my little featured latest video and stuff. The book that I was talking about that I'm reading, which is Nurturing Resilience.
So cool.
And then a quote thing and then a mailing list thing, which I still need to make this look all pretty, but you get that in the big jobs. And then I've got my my page here where you can put a little axolotl. Isn't it cute?
So cute. I love the trademark. I need a trademark like that.
You do. And then like this little bit here so you can look at like if you want to individually look at which ones are like my blog pieces or like opinion pieces that I have like about race in the dissociative community, which is a whole other thing. And then like my therapy sessions. So like usually like I have them in my little section and little brief on what the therapy is like, and then I got the recording, and then I've also got the actual full dialogue as well that I've written down because we stand accessibility. Accessibility is a good wisdom. So I've got all that, and then I've got my little BIPOC area where I've got my little featured artists and some creators to follow. A book that I'm reading, which is White Fragility, which I highly recommend. This I still need to put a section in. But and then my little collab series that I've done in the past. So I'm also working on having a little a section of resources. It's just that it takes time because I need to actually I need to do this stuff in the things like reading.
Yeah.
But so I thought I'd just show that to everyone. So everyone can be like, oh my God, Ezra, you're like so good at like doing things. I'd be like, I know, right?
You're so good at doing stuff and things.
Doing stuff and things. I'm so talented.
It's so funny. Oh my god. People
But yeah,
are
thank
checking
you
out your
so much
channel
for having
already.
me. Oh my god, thanks guys. I don't post videos anymore, but thanks.
No, but the
But definitely check out my website. I post there like every couple of weeks or so is when I post a new thing.
People want to keep up to date.
Yeah, definitely. But it's been really nice being here. Thank you everyone for the questions.
Oh yeah, thanks,
and thank you Michelle for having me. It's been so lovely to be here.
Anytime, absolutely honored. And yeah, like, subscribe, and thank you all for being here. What's up? We could not end it without your dog having main character syndrome. I might just end it though. Bye, y'all.